Senator Manchin.
He's our leader, that's for sure. Thank you, Senator Tester. I appreciate it very much. This is to everyone on the panel. On average, one West Virginia dies by suicide every 24 hours. In a recent report by the Centers for Disease Control and Prevention, the Mountain State has experienced a 37% increase in suicide deaths since 1999, and there is no group more impacted than our military veterans. The Department of Veterans Affairs estimates that more than 17 veterans die by suicide every single day across the United States, 20 a day if you include military members. That means the suicide rate among veterans is nearly twice that of the general population. And for some groups, like the 18 to 34-year-old groups, it's increasing rapidly. It's a national tragedy. I think we all agree on that. The brave men and women who have fought for our country and have served, risked their lives for our nation, deserve nothing less than the very best we can offer. So I'm proud to be an original co-sponsor of Senate Bill 785, which will give a new approach, and I join our colleagues in calling for the House to pass the bill also. My question would be, what do you think, or why do you think the VA's efforts to date have not reduced to 17 suicides per day? I know that we've all seen it, we've all acknowledged it, but nothing has worked to date. Can you give me any reasons, if anyone wants to speak up, what we have not accomplished or what we could do better?
Senator Manchin, if you don't mind me stepping in my other panelists.
Please.
I think this is Jim Lorraine from America's Warrior Partnership. I think that the key is knowing who the veteran is first and building a relationship. I think suicide prevention is holistic. It's relationship based. The fact that in the most recent study, 16 of the 20 were not enrolled in the VA. Those are veterans who are outside the VA system. They're not seeking assistance. They're not asking for help. And it takes getting into the community, getting to know who the veterans are. To Senator Brown's point, in Ohio, the county VSOs are key. I think county VSOs are important. I think the big VSOs are important. I think all of us working together to get to know who the veterans are, build a relationship, connect them to the services that they need, and then help them move forward in their life.
Let me say one more thing if I can, and anybody can jump in on this also. One of the first lines of defense that we have preventing veteran suicide is the Veterans Crisis Line and the National Suicide Prevention Lifeline. That number is 1-800-273-8255. How many veterans or the family members or caregivers do you think have that number memorized? How many do you actually think could have that number ready to dial during a time of crisis? I would hate to say that I don't think many do and know that number by heart, which is why that I've advocated with my colleagues for a 3-digit dialing code for hotline. I'm pleased that the FCC followed our calls and approved 988. I repeat, 988 as the 3-digit dialing code for the Veterans Crisis Line and National Suicide Prevention Lifeline. Again, that number will be 988. It'll go into effect on July the 16th in 2022. What does the VA and Veterans Crisis Line or the Crisis Line need to do to prepare to launch 988? It might be the first time some of you have heard. I don't know how well it's been publicized, but it's something that we desperately need, and we're hoping that you all will jump right in.
I'm happy to add to that, Senator Manchin. Completely agree and would support that lifeline, absolutely. I think one of the things that we at IAVA find is that many veterans, and especially veteran family members, don't know who to reach out to in a time of crisis. I think more often than not, we get people that realize that a family member, a friend, maybe the veteran themselves is in a time of crisis, but they don't know where to turn to, they don't know how to turn to that. We have a program called the Quick Reaction Force, and since its foundation in 2012, one of the top reasons why veterans and their family members reach out to us is for help connecting to to mental health options that they can turn to. Sometimes it's because they don't want to use the VA. Maybe they've had a bad experience. So the S785, we really support the grants option to that because I think it can get community support services where local people can realize where they can turn to and get veterans help in a quick and timely manner. Thank you.
Well, I thank all you panelists for what you do. I mean, we are all so patriotic in our state and every state, and we are as Americans very patriotic. But there's somewhere close to 40,000 nonprofits that work for veterans in some way, shape, or form. That's in addition to what the VA and all the other public organizations that deal with veterans issues. So I would say, what have we found, whether it be a program or intervention, treatment, therapy, et cetera, that is actually proven to prevent veteran suicide? What do we know that works, and what evidence-based research is out there that shows links between intervention and lower veteran suicide? So anybody that would have any comments on that, that'll be the end of my questions. And again, I want to thank you, Senator Tester, for being so kind, and I'd like to hear anybody have any things on what we can do to make the system we have working. 40 nonprofits are concerned about this.
Senator Manchin, one of the things that I think is really exciting about this bill is that emergency department measure, and that is a research proven program. It's been worked on for 10 years. It has now become one of the top 2 clinical priorities for the VA. That is a place where we can connect with veterans who are in need of suicide. There's no question why they're there, and deliver that intervention. It can be delivered through telehealth. This bill has a report to help support that. Right now, the VA has the goal of expanding that out to 94% of VA emergency rooms. Personally, I believe that needs to be in every emergency room in the country, because it's a proven intervention. And with what we can do with telehealth right now, there's no reason it shouldn't be right there and accessible every time a man or woman walks into the emergency department in crisis. Thank you, sir.
Thank you all so much. I appreciate your service. Thank you.
Thank you, Senator Manchin.